Want to heal your slap tear quickly and get back to peak performance? Tune in as we chat to a top tier sports physio and two guys, us, who've not only fully recovered from slap tears without surgery, but have also applied this game changing method to rapidly fix shoulder injuries globally. Forget years of ineffective treatments. We're talking about transforming lives in just weeks. So if you're feeling deflated after your slap tear diagnosis or slow recovery, this is for you. Welcome to the show, everybody. Today we have a very special guest here, Phil White, who is a physiotherapist. He's a great friend of ours, aka Dr. Phil, for any of those of you who have been listening to us for a while. He's back. He's in the house. How are you going, Phil?
G'day, guys. So stoked to be back. Miss our days of podcasting every day. So
yeah, this is a new experience. We're all in different parts of the country now, but we're here today. How are you, Yanni? I'm joined by my brother as well, Yanni. How you doing?
Yes, I'm great. I'm very excited about this. It's been a long time coming. Phil had to travel around the world and have babies and all sorts of amazing stuff before we could get him back. But now he's back. Maybe you could spend 30 seconds, 60 seconds giving us a recap for the OGs who know you well. What have you been up to?
Basically, after the Unity blokes left the gym and moved on to the online space, it was a bit of a different vibe in the gym. A CrossFit gym took over. Lovely guys, but wasn't quite for me. So after 18 months there, I decided to ditch the clinic and follow in their footsteps and go entirely online. And that corresponded, with going to England and then Broome for 10 weeks in WA, Western Australia. And spending lots of time with my little 11-month-old baby now and starting an online business. So it's been great. And so glad that it gives me the flexibility to jump back online with these podcast episodes again.
Yeah, so cool. So cool. Okay, so I am going to introduce our show today. So today we're going to be talking about my slap tears. Anybody that has a slap tear, this is for you. Listen up, because I've rehabilitated a slap tear in my right shoulder, and then I got another one 14 months later in the left shoulder, and both of them are fully rehabilitated, no surgery, stronger than I've ever been before. And it's off the back end of working with Phil and two other incredible sports physios, learning the methods for how to rehabilitate slap tears. We have created some pretty cool shoulder rehab programs in the app. And we had a couple of 5-star Google reviews from some of our members that have had life-changing results. So Karina was one of the first ones. She's been suffering terrible shoulder pain from rotator cuff tears that she couldn't overcome after years of seeing physios and chiros and sports masseuses, and no more shoulder pain with immediate improvements from day one training with the UMS. 2 months later, completely shoulder pain free. We've also had a similar result from Dane Anderson and also a similar result from Teresa. And these are all just people that have given us a review in the last couple of days. So the reason why I wanted to do this show is that there seems to be a pretty common myth out there, which is that when you have a traumatic shoulder injury like a slap tear, that you should abstain from exercise and from going to the gym because it's going to make things worse. And my experience was the complete opposite. And I had what a lot of people would call almost a miracle recovery, to be able to do what I can do again after slap tears with no surgery. And it's because I had great access to some incredible sports physios. And Phil White at the time was working out of Unity Gym. So he was there when I got my MRI and I came back with the slap tear. And I remember the way that he looked at me. He didn't, like, I had other friends who were medical professionals who gave me the, oh, wow, oh, you're really in trouble now. And Phil kind of just looked at me and smiled and went, oh, well, we'll have to change your training for a little while. And that was basically the approach. It wasn't, he taught me this concept that I wasn't an injured person that was in rehabilitation. He taught me that I just had an injury and I had to regress my exercises to be able to train the pain-free range, strengthen the inner unit and the outer unit, remind the scapular stabilizers and the rotator cuff how to do their job properly. And Phil had me doing behind the head shoulder pressing. I shouldn't say he had me doing. He encouraged me to give it a go about 12 to 16 weeks after my slap tears. And I'll bring up some videos in a minute of me doing some behind the head shoulder pressing only 12 to 16 weeks after my slap tears. So the reason why we wanted to get Phil on the show today is because we want to help people to understand that despite what you may have been told by surgeons, despite what you may have been told by physiotherapists, despite what you may just believe by what you've heard online, even though you've had a traumatic shoulder injury, you can and should be exercising to get you back to where you want to be.
somewhere in the world, a physical therapist fairy just died having behind the head shoulder press after a slap tear after a few weeks. I can hear Phil's heartbeat just starting to increase his heart rate.
And
What
just
are
to
you
be
telling
clear,
them?
it wasn't necessarily an exercise prescription, but the framework I use is basically understanding which symptoms to look out for, having an understanding of tissue healing times and which structures are involved, and then with that knowledge, gradually exposing your body to different ranges, different loads, and over time, and then assessing from the feedback. So Rad was enthusiastic to do it, and he ticked all the boxes to make it worthwhile to give it a go, and yeah, good result.
Yeah, and I should just quickly say, and this is somewhat of a disclaimer. Rad introduces this as a joyous experience, but he had a very unique scenario with his injuries, whereby we at the time had a number of extremely good sports physiotherapists working in our gym, and we all used to train together most of the time. But there was seldom a time when you felt like asking a question and you couldn't just ask someone who was an esteemed physical therapist who could give you a really, really good answer or some feedback on the spot. Very few people get the same situation. So that put Rad in a very unique position to learn and also to rehab. So when we talk about our stories, of course, learn from our experiences, but take it with a grain of salt, because you're going to most likely be training on your own in your rehab, and you'll be checking in with a good physical therapist like Phil, hopefully regularly. But it's going to be a slightly different situation.
Yeah, and so this is me. This was when we were filming our phase 3 UMS gym workouts, and that was about 16 weeks post slap tear. And yeah, to clarify, for if we are going to get anybody chiming in here going, "Oh my God, that's so dangerous," the nature of what I did when I first had my slap tear, I couldn't lift my arm past here. It was so painful. And then, working with Phil and understanding how to use range of motion as a form of progressive overload, and starting with like a dumbbell floor press just here, and then moving to a chest press, and then moving to a slight incline chest press, and eventually overhead. And then, Phil was just encouraging me. He used to just say, "Hey, look, just keep testing your range and see what you've got." And so I started by doing dowel rod behind the head press. And the first time I did it, I could barely get the dowel rod down to here, and eventually when I got the dowel rod down to my traps, I put a tiny bit of weight on each side. And so it's using this progressive overload. It's not like, "Oh, I've got a slap tear, let's try a behind the head shoulder press. It's been 3 months." You're right, Yanni, to clarify that. That's not how the process went.
And in fairness, I don't know if you'd call that lifting a behind the head. That was more like you had 25 kilos in your hands. I thought you were going to show us a 60 kilo behind the head press in that demonstration.
But I'm showing, but that's what it was, right? It's this progressive overload. And
would it be worth, just quickly for those playing along at home who have just heard these terms like slap tear and then the review talking about rotator cuff, just clarifying what those are and some of the
for sure. So
because I know that
let's talk
it can be so much like jargon and terminology, and
100%.
especially
so tell us, what is a slap tear?
Yeah, so I think the best way to think about your body is breaking it down in 2 buckets. So you got your active structures on one side and your passive structures on the other. Your active is anything that you can contract and move voluntarily or involuntary with basically your muscles, and then you've got your passive structures, which is going to be your bones, your ligaments, and your cartilage, joint capsules, all that side of things. So with Rad and his slap tear, the slap tear is the tendon and cartilage attachment inside the shoulder joint. So you've got a ball and socket joint, and the slap it refers to superior labrum anterior posterior, and basically it's where one of the bicep tendons, for example, comes down, attaches into some cartilage that then it creates a bit of support and stability around the shoulder. So it's one of the passive structures that then has an attachment via tendon to a muscle, which is an active structure. So just to contrast that with the rotator cuff tear, which is actually a active structure itself. So the rotator cuff are 4 muscles, and they all add to the stability of the shoulder. So I think it's kind of good to have that idea of active and passive, because often with passive structure injuries, like a slap tear, any cartilage damage, meniscus tear, or in the hip, like a FAI is a really common thing that's similar to slap tears. It's cartilage damage, which is one of your passive structures. So when people get freaked out by this, I think, oh, cartilage doesn't heal well. It takes so much load in the joint, and it really, like, if it doesn't heal, then you're not going to be able to use the joint forever. But fortunately, the body is just so clever by having these active structures and passive structures. You've got two different systems there, and the more you can create stability through those active structures, the less it's going to load up the passive structures. So that's where, like, hopefully that just clarifies a few things where, and again, Rad was in a good position by having lots of very strong musculature, good structural balance from all of his, great training for years. So he's had a lot of things in the right place to then mean that, like, his muscles and the stability he got through training them, gradually exposing them to range, could then make up for the passive structure injury.
Yeah, absolutely.
Sorry, Rad, can I jump in, please, quickly? Because this is a great segue into where I think we should take this conversation, which is this concept that people are told to abstain from exercise while they're rehabbing an injury. But I think what we should be trying to encourage is that people look at it all together. Rehab, where you're being prescribed exercises by a physical therapist, and strength training are all sort of one. Really, what we should try to encourage people to look at it is as really more a regression to the type of exercise you're doing, the type of load you're doing, the type of volume that you're doing, rather than, okay, we've stopped or we're abstaining from strength training and you're in the naughty corner doing rehab now because you're compromised. And I think that if we can make that mindset shift from the beginning, then people are in a much better position to actually improve and overcome an issue, because ultimately what's going to overcome the issue is not a couple of fancy rehab exercises. It's a continuation of the development of strength, like Phil just said there, to increase the active structures, because he made a very, very strong and important point there that should be reiterated and maybe said a few times so that it really sinks in. What is going to make the passive structures more resistant and resilient to injury is strong active structures. The stronger we can make the active structures, the muscles that we can see and feel in the mirror, that we can consciously contract, the stronger they get, then the less we need to rely on a perfect anatomical passive structure in the body. Because maybe it's worth saying, Phil, the reality is that Rad never went and had an operation. So the passive structure in there, the cartilage, it probably doesn't look too different to what it would have looked like originally when he went and got his MRIs to confirm the slap tear. Like, there's an argument to say that won't ever, look the same as what it looked like prior to the injury. But what makes the difference up is that he's got this amazing structure around it supporting it. And that's what people should all aim for, right?
Yeah, there's definitely like an interesting challenge with tendons and cartilage in that they do have much lower blood supply than your musculature. So healing and getting back to how it looked originally is less common, but there certainly is still healing that can happen. So, but I think the really important thing to understand is that, like, you don't have to have perfectly like intact cartilage, whether that's your knee or your shoulder, to be pain-free. And if you scanned most people in the, like, especially in like the sort of 60 plus age group, for weight-bearing joints and any joints that have had, some like serious load of their life, like, they're not going to look pristine. They're not going to look, perfect, but you wouldn't be able to tell by looking at the scans who was experiencing pain and who wasn't, because there's just so many more factors than the structural, like, perfectness, the structural integrity of the cartilage than that influences pain. Because pain science is a whole different chat, which any of the old listeners will know that I love talking about. But like, you can basically have, like, damage does not equal pain. This is the takeaway. So
yeah, for sure. And something that, like, my segue into this as well, which is that I really, what Yanni was leaning towards and what we do want to talk about today is the difference between the approach of a physiotherapist that sees an able-bodied person as somebody to get back out on the field and back playing again as quickly as possible, as opposed to a physiotherapist who is looking at general population more, people that have often never stepped foot in a gym, and their approach to rehabilitation is going to be quite different. And the majority of our listeners are people that have some skin in the game with training. the majority of people that come to us and that are commenting on our videos are usually people that have been training for 12 months or more. And if you're not, that's totally fine. This is still going to be applicable for you. But my experience when I did my first slap tear, I went and saw Leroy first. And for those of you that don't know, Leroy was at the time the head sports physiotherapist for the GWS Giants. Is that right, Phil?
Yeah, which is a professional AFL team.
Professional AFL team.
AFL's the most funding sport in Australia. If you're in America, it's kind of like the NFL gridiron equivalent.
It's the most elite athletes in the country. And Phil was mentored by Leroy for a while when he was studying physiotherapy. And Yanni and I have been fortunate enough to be friends with Leroy for a couple of decades. So he doesn't see people that aren't athletes, but he made some time for me. And the first things he taught me, he just showed me a couple of exercises to, in his own words, to reawaken the scapular stabilizers and the rotator cuff to remind them to do their job properly, because the shoulder had locked down and these inner unit systems had just really sort of forgotten how to do their job. And I was getting joint glide, I was getting dysfunctional shoulder movement. And
pain inhibition is an actual thing where, like, just by the process of having a pain or trauma, your body, like your brain's quite smart at like realizing like, oh, we better protect this area, so let's lock everything down there by not activating these muscles and making it painful and hard to move things. Like that's a predictive mechanism, but if it's trying to do that for too long, because you don't move out of that, then that's where it causes problems.
Yeah. And he basically just told me, he said, look, just do these couple of exercises that you do them before your workout, exercises that I would normally do after the workout because I'd consider them supplementary exercises. But he said the goal of this is to basically switch on that neuromuscular connection with these muscle systems again, and then go and do a workout that just uses a range of motion that you can comfortably control. And that's where I worked with Phil. And Phil, I would say, what exercises should I do? And Phil would explore my pain-free range and said, yeah, you can work on this for a little while. And that all progressed pretty quickly. Like it was almost every 2 or 3 weeks that I was able to sort of add a few new exercises in there. And it was this approach coming from physiotherapists that weren't looking at me like, okay, you can only do this and you should avoid this, which of course was specific to me. It was specific to somebody that had a rich history of exercise and of strength training. But that was very, very different to the kind of approach that I've heard other people describe what a physio has told them when they've gone. Like I've got people who are commenting on videos who are saying, I just went to the physio and they gave me 2 exercises to do. And they were really, really basic exercises. A very different approach to what I had.
Yeah, the physio industry, like as a profession, it does throw up a few different challenges where it's inherently quite conservative because there are going to be medico-legal responsibilities. And if you're only seeing someone, for half an hour once a week, and then you just give them a couple of, like, if you just go tell them to train really hard and do, your regular training, if they go off and they can't execute that well and hurt themselves, then, it's sort of on you. So when you can only see someone for such a short amount of time and you're not sure if they're going to come back, then it sort of encourages you like to be conservative and add just a few small exercises and sort of let like natural course of healing do most of the job. But unfortunately, that does leave people in a position where often that like incentive that drives the physio then becomes a really entrenched belief that they're not capable of more. So it's a really challenging area that I found like making a business model in physio a clinic really quite hard, and that's why I've moved to online coaching, because now I can work with people like in the moment and talk them through these things and give them more instruction around exercise and video feedback, that kind of thing. Because I found the conventional physio model just so hard to be confident that if you told someone like Brad, to do what Brad did without being there every step of the way, it's just puts you in a bit of a tricky situation. So
yeah, I couldn't agree more. And like to bring this in for a landing, this episode, I really believe, like my final thought, this is my lasting thought, is have a think about what you've just heard us all describe about these different approaches to physiotherapy and to rehabilitation for a slap tear. And if you're somebody listening to this, think about which bucket do you put yourself in? Do you put yourself in that bucket of somebody who really wants to get back to the activities that they love to do, like be it beach volleyball, be it rock climbing, be it martial arts, be it just going to the gym and lifting heavy weights? Or are you somebody that needs a lot more of their hand being held and need to work from the grassroots up? And there's no right or wrong answer, but I would say that if you are somebody that's in that earlier category, the person who's really serious about their training, and you can relate to that review that I read at the start of this show from Karina and from some of our other members, then come along, give this a try. Try the UMS, where we can work with you inside and create a customized program that's going to help you to overcome those injuries, and you get access to Phil. And if you want to work with Phil directly, you can go to philwhite.me. Is that right, Phil?
Yep. Yeah, that's
Phil,
right. Me.
Yep. Phil also works with clients within our app. When people within the app are starting to ask me questions that are beyond my comprehension, I refer them on to Phil. So when you're in the UMS tribe membership, you're under a really good umbrella of people that can help you out. Yanni, Phil, have you guys got any closing thoughts?
Yeah, just before we finish, people who've listened to me on the podcast before are probably used to my disclaimers. Like, it is really important, and as I said, like, it's quite a conservative industry, and it is a bit scary coming on to with some personal trainers who can say anything pretty freely, but I have to be really sort of careful about what I say. So I do really encourage you, and realize that when we've been talking about these people, like, this is in the situation where you do actually have a diagnosis and you know what structures are involved. So make sure that, like, if you are injured and you're not sure what's going on, first you start out by knowing what is happening. So then you can work within the guidance of tissue healing times, and know that if there is anything serious that you just definitely need to get surgery on. Like, if you snap an Achilles, you just need to get that thing stitched up, because it doesn't really heal on its own. So just work with make sure you've seen a professional, and then the things to figure out from the professional is, what are the symptoms that I have to look what are the expected times for healing, and what are the symptoms that I have to look out for to know that it's I'm doing something detrimental. Because if you can get into your training with that confidence that what's right and
what's
what
the red flag,
then that gives you that confidence to take the progressions. And I guess I'll not add anything in new here, but I have a pretty clear 5 different variables that you look to figure out what's your aggravating factors. So you figure those out, and you know what symptoms you're looking out for, and then that will give you that confidence and guidance that you can move forward. So start with knowing what you're dealing with, and then work with the symptoms and progressions.
I would my closing thought is for anyone going through any sort of injury like this, and we're talking specifically about a slap tear, which I've also dealt with and overcome, and same with Phil. I would just urge people to not be afraid of getting a second opinion, because there are very different practitioners out there, and there are times, I've had to have surgery a number of times for a knee reconstruction. I've had an ankle reconstruction due to traumatic injuries. I've had reconstructive surgery on my hand, I opted not to have reconstructive surgery on my shoulder when I had a slap tear because I got a number of opinions, and the first 3 surgeons that I went to speak to, and the sports doctor, they were adamant that I needed a shoulder reconstruction. And it wasn't until I went to the 4th surgeon, who sent me to our friend Leroy, who said, "Listen, you've got all of the framework and the foundation to avoid surgery. You're very strong. You already train 5 to 6 days a week, and I believe that with the right regression and guidance, you'll overcome this and be 100% back to normal without any training." And I'm really, really glad that I went for that 4th opinion. The first 3, and a lot of practitioners, when all they deal with is compromised people, when all they, if you're a hammer, all you see is nails. You just want to, get people on the table and cut them open. But you've got to understand that even if you opt for surgery, in any case, it's the rehabilitation exercise that you do afterwards, which is going to be the end result to getting you back on your feet and operating and functioning normally. So
and
in any
exercise
case,
you can do beforehand, ideally as well, just to throw that in there. Often, it's a really common thing that people get sign up for surgery. It's in 12 weeks, and then they just are told to work with a physio up until then, and then decide not to have the surgery. So just have that in mind if you are taking.
This is the point. My argument and my closing thought is, in any case, exercise is going to be a major fundamental component in your recovery. So why not start exercising immediately and work with a physio? And then my last comment, my final comment is, make sure that the physical therapist or physiotherapist, whatever you want to call them, wherever you are in the world, is someone like Phil, whose priority is to get you training long-term, to get you active long-term, and has an approach that includes a progressive line of attack against exercise. You know, someone who's going to progressively increase the amount of load that you're exposed to, so that you develop all of those areas of the body that are going to make sure that you're more resilient in the future. And there is a very big difference between physical therapists. Some
and just a quick tip on that is like hearing Yanni talk about finding 4 different surgeons, like that's a expensive and frustrating experience. So a way to kind of shortcut that is to try and find people who have either experienced what you're going through. So people who've had the same injuries, and there's plenty of, like, most health practitioners get in there because, like, into this job because, you know, we've been injured and we want to figure ourselves out. Or find people who, if not have had it, then work with the type of athlete that you want to be. So whether that's like a general pop person, find people who work with general pop. If you want to get into, you know, like more competitive sports, like work with someone who is encouraging, like knows how to get people back to that level. So those 2 things will make it much easier to sort of like filter through, because there's so many different people around.
I love that. I love that final thought that you just said there, Phil. You know, work with somebody that's either done it themselves or that works with people that do that stuff themselves. So that's really, really cool.
We call it skin in the game, having skin in the game.
Skin in the game. And I'd just like to say as well, everything that I did with Phil, if you're wondering how this stuff works online, Phil didn't put his hands on me once. It wasn't that I had a physiotherapist there massaging me and doing these things that people kind of think that you get when you're in rehab. It's
no taping, no like
there was
no needles.
There was literally no physical contact. It was just that Phil was asking me questions and I was asking him questions, and then he was getting me to do certain movements and ask me what my feedback was, and then that gave him, he gave me advice that I then implemented into the way that I was training. And that progressive approach got me, you know, back to doing behind the head shoulder presses within about 4 months, which was huge considering that I could not lift my arm past there, you know, before I started that journey. I really couldn't. It was so agonizing. It was so painful. So
I think a clear distinction, because people will go and see a physio and not really know whether they're in the right hands. A really, really good distinction of the type of physio you want to work with, if your priority is to get back to exercising, is if in that initial consultation they ask if they can get a hold of your exercise programs from the past, to have a look at them and have a look at how you've been progressively overloading. And I know that Phil, that's a real unique feature of Phil's practice. When he consults with you, he will look at your programming and have a look at how you're progressing, and he'll be able to take a whole heap from that data about your load management practices and all that sort of thing. You know, would I be right in suggesting that, Phil?
Yeah, and I think like largely it's about finding out what's important to you to make sure that, like, the hardest thing with exercise is losing momentum from an injury and feeling like that purpose you had pre-injury is now suddenly gone, and it's really hard to then keep that positive health spiral of your recovery, your training, your nutrition, your stress management, your motivation, like all of those things. When you have an injury, can start to slip backwards. So by identifying what programs you've done before, what excites you. And I love that you brought up my, rehab is not being in the naughty corner, those words, because that's how I really believe that rehab should be training in the presence of injury. And so knowing what matters to you and making sure that, you know, even if when I've had shoulder injuries in the past, then I've made that a chance to really work on my running or my lower body strength. So keeping you engaged, so it's not just doing these, like getting a few boring exercises you know you'll never do, and keeping it meaningful and purposeful, and keeping that positive health spiral heading in the right direction.
Ooh, I like that. I think that's the quote of the day. Injury rehab is training in the presence of injury.
Yeah. So team, if you want to go further with this, if you want to get some online coaching to fix your slap tear, you can go to unitygym.com, check out the Unity Gym, the UMS Tribe membership there, which is where you'll be working with Yanni and me and our team, and we create custom programs for you and coach you as well. And if you want to just skip all of that and go straight to Phil, you can go to philwhite.me. Thanks so much.
Can I just quickly plug my Twitter? I've just got into posting an article every day on Twitter. So really trying to get content out there that is answering questions from my audience. So if you have any questions that you'd like me to write a short article on, I'm doing a post a day, so jump on there.
How do they find you on Twitter?
And it's X, by the way, it's not Twitter.
X.com. Phil White Physio is where you can find me on any social.
So at Phil White Physio. Okay, awesome. Right. Awesome. All right. Thanks, team. We'll see you in our next episode. Have a wonderful
Thanks
day.
for being back. See ya.